Take our seats. Asanteni sana. Your Excellencies, distinguished ladies and gentlemen, Article 43(2) of our Constitution, the supreme law of the Republic of Kenya, makes a clear and unequivocal declaration. A person shall not be denied emergency medical treatment. In just 9 words, our Constitution affirms the value of every Kenyan life and establishes an obligation that binds every government, every health institution, and every health provider. Yes, too many Kenyans, and for too many of them, this constitutional guarantee has remained beyond reach. In the critical moment when a mother develops complications during childbirth, a child is injured in school, a rider is knocked down on the highway, or a father suddenly feels a tightening in their chest, families have often been left to fend for themselves. In a medical emergency, every minute matters. Doctors call the first 60 minutes the golden hour because what happens during the brief window can determine whether a patient lives, recovers fully, or suffers permanent injury or even death. For too long, the fate of a Kenyan facing an emergency has depended on 3 things: the money in their pocket, where they happen to live, and who they happen to know. That is not the equality promised or the guarantee given or envisaged by the Constitution. It is playing a lottery on human life. Today, we change that, and we change it permanently. We are turning a constitutional guarantee into a service that every Kenyan can reach throughout the launch and through the launch of the SHA 922 Lifeline and the National Ambulance Dispatch Center. From today, Kenya has one national medical emergency number, 922. I remember when we discussed this subject with my good people at the Ministry of Health and at the Social Health Authority. And we had to negotiate with the IG. I remember calling Douglas there and asking him, between 911 and 922, which one are you surrendering? And he told me, let me think about it. I will come back to you, Mr. President. Today, this is more than an emergency telephone number. It is a national lifeline. It connects a citizen in distress to emergency medical assistance, an available ambulance, an appropriate health facility, and the public financing required to pay for that intervention. When you call 922, the call will be free on every network, and it will be accessible whether you have airtime on your phone or not. A trained emergency dispatcher will answer, establish a location, and assess the emergency. The dispatcher will remain on the line, provide immediate assistance, and identify the nearest available ambulance. Through the National Digital Health System, the dispatcher will also identify the nearest facility capable of treating the patient's specific condition. The objective is not simply to take the patient to the closest hospital, but to take them to the facility best suited to save their lives. Ambulance evacuation and the first 24 hours of emergency treatment will be paid for through the emergency, chronic, and critical illness funds at the approved tariffs. This protection applies whether the patient is registered with SHA or not, and whether or not they have paid for SHA. No deposit, no guarantee, no negotiation, no relatives running around looking for money. Everything will be taken care of. In an emergency, the first question must never be whether a patient can pay. The first duty is to save life. And this is not just mere government policy. It is a constitutional requirement. I therefore reiterate to every health facility contracted by SHA, no person requiring emergency medical treatment shall be denied, delayed, referred, or transferred because they cannot pay, because their cover cannot immediately be confirmed, or because a form is incomplete. They should be served. This is equally an essential national service anchored in the health reforms we have implemented since 2023. Today, I can face the nation and say 32.2 million Kenyans are registered with SHA. 8 million Kenyans have received treatment in the last 18 months. And 178.5 billion has been paid to hospitals, health centers, dispensaries, and other medical facilities. It would have taken the former NHIF possibly 6 years to pay what we have paid in 1.5 years. We have trained and deployed 107,000 community health promoters to take preventive and primary health care directly to households. The Primary Health Care Fund has so far paid 23.3 billion to more than 10,000 health facilities contracted by SHA, directing public resources to the dispensaries and health centers closest to the people. More than 50,000 Kenyans have received cancer care, while nearly 21,000 patients have received dialysis through the National Health System. The Emergency, Chronic, and Critical Illness Fund, financed entirely by the government, has received 8 billion shillings to protect Kenyans when every other safety net runs out. The 922 Lifeline now brings these reforms together. And I'm very proud, by the way. I am very, very proud of what we have achieved in our health reform agenda. I remember sitting in my former office in Karen with many colleagues on this subject of health and discussing how we are going to deliver on this promise. And I also remember the journey we've gone through to get ourselves here. I remember the court cases, the difficulties in Parliament, the many conversations with our county governments, the discouragement from naysayers. But today, I'm very proud that we are launching the final leg of these health reforms. I want to congratulate my team at the Ministry of Health, from the Minister, the PSS, and my team at SHA, Mercy, Anthony, Abdi, the very good people there. And to also appreciate the partnership of the counties, the county governors. We've had long conversations on matters health. Today, together, all of us are proud about what we have achieved. And we can confidently tell the nation that matters health, as required of us by Section 43 of the Constitution of Kenya, that health is not a privilege for those who can afford, for those who have jobs, for those who have money, but health is a right of every citizen. We are making medical emergency a reality today, and I am very proud of this moment. I was looking forward. I remember I have called Waziri here many times. I have had to stick Mercy many times. I looked for the gentleman of Red Cross, that good man. He tried to ask for some money for me. I refused. But I still told him, this must happen. He tried to tell me, can we waive some taxes? I told him, no. Please, let's pay taxes, all of us. And I'm very happy that this moment has come. It's a very, very proud moment. Because progressively, this is just the beginning. The call, the dispatch of ambulance, the admission of the patient, the treatment provided, and the payment made will form one coordinated digital process. I must thank Anthony and the team at the chair there and the team at DHA. They have been an incredible component of our delivery. It would not have happened if we had not gone ahead with technology. The sheer numbers, the body of information, the numbers and figures are mind-boggling. But because of technology, we have managed to do this together. The money will move through the system. It will not move through the patient's pockets. I acknowledge that this service will not succeed through the national institutions alone. Health is a devolved function, and ambulances are operated by county governments, faith-based organizations, the Red Cross Society of Kenya, the Saint Ambulance, and private providers. The National Ambulance Dispatch Center does not take these ambulances away from their owners. It makes them easier to find, coordinate their deployment, and pay for every eligible journey undertaken. So I want to encourage more counties to find mechanisms of contracting more ambulance facilities. I hope we are going to work with St. John's and Red Cross to help them get a bigger pool of ambulances so that finally we have the requisite numbers to make sure that no part of Kenya is too far for us to provide ambulance service for those in need. Coordination is not centralization. It is the difference between 47 separate systems and one public working together to save lives. Already, 1,243 ambulance and emergency service providers have been contracted by SHA. This is a very strong beginning, but it is not enough. I therefore direct SHA, working with the Ministry of Health and the Council of Governors, to complete the onboarding of every eligible public, county, faith-based and private ambulance operator by 30th December this year. This service must work for the pastoralist in Turkana, the farmer who is looking after his coffee in Nyeri, the fisherman in Homa Bay, the hustler in Nairobi, the family traveling on the Rironi Mausame Road or on the road to Mandera, or indeed anywhere in the Republic of Kenya. It must be dependable, responsive, and accountable. Every call must be answered. Every ambulance must be traceable. Every payment must be transparent. Every failure must be investigated and corrected. Today's launch may not resolve every weakness in an emergency healthcare system, but it establishes the foundation of a coordinated national service and imposes upon us the responsibility to improve it continuously. In 2010, we gave ourselves a constitution worthy of our aspirations. The responsibility of us and this generation is to build a public service system worthy of that constitution. Today, with the launch of 922, we take another decisive step towards that goal. Ladies and gentlemen, let me appreciate the many men and women working in different spaces, the drivers, the dispatch, people working at the dispatch center, the paramedics that will be involved in this, the people in hospital, the nurses, the doctors, and everybody who spend time, who deploy their energy, knowledge, effort in making sure that we keep our country safe. Some people ask me, why are numbers important? Why are you talking about the number of farmers we have registered? And we have registered 7.2 million farmers. They ask me, why am I talking about the number of people who are registered in SHA? And we have 32 million of them. And all the other numbers, the 300,000 houses we are building, the 600 markets, and the 180,000 spaces for our children in universities. Numbers are important because data is important. Science is important. When you do not have data, you operate on guesswork. And when you operate on guesswork, you are sure to fail. The reason why we haven't provided clear interventions in the past on matters agriculture is because we didn't have data. Today, we have data on our farmers. We know how many plant coffee, how many plant tea, how many are cattle keepers, how many are macadamia farmers. We know them. That is why we can dispute fertilizer and seeds on a voucher because we know who we are dealing with. We've gotten rid of corruption. We've gotten rid of mischief. We have removed brokers because we are operating on the basis of data. Today, when I say we have 32.2 million people registered in SHA, it's because we have data. And that data is working miracles for us. In the past, it was a game of guesswork. Today, we know who we are paying. Today, we know what we are paying for. And that is the essence of accountability. And that is how we are going to transform our nation. Apart from health, Section 43 of the Constitution talks about education. It talks about agriculture and making sure that no Kenyan suffers the indignity of hunger. Talks about what will finally become the cost of living in our nation. That question we must answer. And that is why I have asked the people of Kenya that we must have a national conversation about our future, about the economic fortunes of our country and the development of this nation. You just heard Minister Duale here say, in some parts of Kenya, distance is a bigger danger than the disease you may suffer. We need to find how we can reduce that distance. And that is why we have started the journey to have clear interventions on matters infrastructure, on matters energy, on matters food security. That's why we have established the National Infrastructure Fund. And we need to work together to build a Kenya that all of us must be proud of. And I say this clearly understanding, as the leader in the nation today, what the potential of our nation is and what we can achieve and what we should and must and will achieve if we work together. So this is a very, very proud moment for me, and I have asked CS Duale and my good friend, Chair of Council of Governors, and all the partners we are working with, that it is time for us to have a health summit. CS Duale says it's already been set for the 18th, I think, and 19th, so that we can take stock of where we've been, where we are, and where we should go. And what are the successes, what are the challenges, and how together we can secure the future of our country insofar as our medical requirements are concerned. I am looking forward to having a conversation with those who run facilities in far-flung areas. I am looking forward to having a conversation with our CHPs. They can tell us their experience. And our doctors and all the other people in between, and the Kenyan public on the experience they've gone through, so that we can together again formulate how we can make things better and how we can take our country to the next level. Today, we are saying one country, one emergency number, one clear duty to save every life that we can. Asanteni sana. Thank you very much.